Specialized diet. See, this is a specialized diet. It's really this is a kapasura kudinir and then juices and they're given every second hour, fourth hour, the eighth hour like that. They have a protocol and then give accordingly. And then we started a follow-up clinic. In the follow-up clinic, we have crossed 1,000 cases, and we are analyzing the data on those things. We'll be really soon we'll be having an information on that. So, in concluding this summary, the monthly trend of admission is in downward trend. 21 to 60 years are majority affected. Males are affected more, 62%. 16.4% were symptomatic among the admitted patients. Fever, cough, and respiratory distress were most common symptoms. 23% of asymptomatic patients have CT findings. They will even I have noticed 70 to 80% CT finding. They are very asymptomatic. They gone very well without oxygen support. Those cases also we have noticed. Diabetes is the major comorbidity followed by hypertension. Monthly death count is in a downward trend. Case fatality in a downward trend. Age-specific mortality increases as the age increases. Definitely, maximum is in 51 to 60 years, but it increases as the age increases. 82% of this had comorbidities. 69% death often less than 5 days because of late presentation. Off days nowadays it is coming down. That data is also taking a good look. 66% of the SARI cases become COVID positive. That's very, very important. Out of the 109 patients enrolled in the SALDA trial, 90 patients have been discharged. That is the 10% mortality was there. Those all patients had a very high CPAP and then HFNO and then very high amount of oxygen required at the initial stage of enrolling them. And then I take this opportunity. I was honored the Courier Award by the Honorable Chief Minister today. Thank you.
So that is a wonderful talk, sir. You brought the entire picture how Rajiv Gandhi Hospital did a wonderful, commendable job in controlling the COVID-19 pandemic in this state, and it leads the entire Tamil Nadu. And many of the colleges, including ours and Karpagavanega, would have learned a lot from Rajiv Gandhi Hospital protocol, and we are happy that you shared your experience with us. And Kulathangan sir, do you want to say anything?
Yes, I have. And Dr. V. Raghavan has shared his experiences regarding Chennai, and which is very unique to our whole world. Chennai is definitely different from other part of the world, which has aptly brought out his in detail and giving few examples of cases he has treated. And as usual, on behalf of the viewers, we have 3 questions. Since we are running behind schedule, but I like to ask only 3 questions. Number 1 question is: have you been able to identify factors in our population for incidence, morbidity, and mortality?
So the incidents, this is being taken from the people from the corporation, Chennai corporations. My friend there, that the incidence rate they have given. You can see the incidence rate I have displayed there. Per lakh, per 1,000 people, how much incidents? Around 2,000, 3,000 were in different parts of the different places. In Annanagar it's around 3,000, in Tenabet it's around 2,000, in Peramur it is 1,000, like that. This has been purely calculated on the basis of some formulas that they're having, and then other outputs they're putting the incidents and they're giving it. This is the incident there. This is the way the corporation works, and then put all the restrictions where it has to be. Clinics has to be started. All the more number of tests have started depending upon the incident and other calculation they do that.
Okay, thank you, sir. The next question will be regarding remdesivir. Who has told, WHO has told, remdesivir is of not much use recently, 2 days back. What is your experience in, you have been regularly using remdesivir and RGTH. What is your experience?
So that's what I'm saying. Initially, we started on exactly. Still, I remember the first case I started is 23rd of May. We started through the SALDA trial. To be very honest, the first dose that we are giving, we're really afraid. In the sense, we don't know. We have not started the drug. That's the first time we are starting the drugs. We are asking the patients to go for every half an hourly, every hourly, and then every second hourly. We are doing that way. Then of course after that, seeing that it is not not like a dangerous drug, we are confidently we are giving, taking into consideration all the prerequisites for administering the drugs and other things. But coming to a question straight away right now, sir, so we have noticed that the patients who require lot of oxygen, in the sense more than 10 liters to 15 liters, and then tachypneic, very tachypneic. What I'm trying to say is on the category of a severe category, and then requiring SFNO, requiring a CPAP, on the day of administering the first dose of remdesivir, the benefit of that, we feel it is not good. So what I'm trying to say here is, why this happens, why the patient goes to SFNO and CPAP so early. So when they come to the hospital, which means that the disease was there for them at least 10 days before the coming to the hospital. So the viral replication has been stopped. What is the point in giving a viral drug, antiviral drug, when the viral replication really stops? So up to 9 days, you can have the viral particles. After that, it's going, the dead particles will be becoming positive. But giving an antiviral drug, which has as another, because by the 9th, 10th, and 11th day, the system also has an effect on the kidney. The system also has an effect on the liver. When these drug, remdesivir has the effect on both kidney and the liver, adding the drug will do much more harm than giving a benefit to the patient. That is what our observation is. Still, the trial is going on, still data is going on, but our interim analysis is that it should not be given very late in the disease. The patients requiring high amount of oxygen support or something.
Thank you, sir. On the guarded measure, you can give remdesivir, you mean?
Yes, sir. You can give remdesivir, sir. On the early stages, it is beneficial. That is our feeling. In the early stages, when they come to us, within a fever, 1 or 2 days, they come to us, and the inflammatory markers rise to the category, in the moderate category, you start remdesivir. We noticed, because still on the trial, still on the study has to be published. Interim, I am saying that still it is beneficial. To our experience, it is beneficial.
Thank you, sir. Thank you. One more last question is, what is the proportion of death and admission at the beginning and at now, recently?
Yeah, definitely. Nice question, sir. This is because we really have to, I take this time to appreciate our postgraduate assistants and everybody, because initially, the apprehension, fear, everything. Nowadays, you can see the postgraduate assistants casually careful, but maybe because they know how to handle it, maybe because they know how to handle the PP and other things. The extent they are really looking after the patients very nicely. And then more, we know the detail of the patients, we know the disease pattern, and when to hit the back, all these things we know right now. The mortality has reduced dramatically in our setup, and it is on the downward trend. We are very, very confident which patient is going to clearly make it out, and which patient needs very high amount of care, high amount of intensive care. All this, seeing the patients on the first day itself, and seeing the investigation itself, can be really saying this, yes, this patient has to be closely monitored, this patient will follow up very nicely, this patient will come out very nicely. That amount of expertise, I think we had over the course experience we had over the course of time. Now the thing is, it is definitely on the decreasing trend on the mortality point of view. Maybe because all these factors, knowledge, input, experience, and other things, learning by others, everything compounded in decreasing the mortality rate.
Thank you, sir. Very good news. You have given that the COVID-19 pandemic is out of the world now. Thank you, sir.
Thank you, sir.
Thank you for sharing experience. Thank you.
Thank you. Thank you.